Hey everybody, Dr. Patel here. Sorry about the delay. Hope you all are doing well. Welcome to this week's Facebook Live, where we're going to be talking about post-COVID pain. So if you enjoy this video, if you like it, then please like, share, press one of the buttons over here or whatever it may be, and let people know that I'm out here because I'm here for you. And if there's any other topics that you want to talk about, then please send it our way. You can always contact us via commenting, DMing, or emailing us at info@fxregencenter.com. Today we had a request to talk about pain associated with COVID. It's been a while since I've talked about the good old Rona. It's been a crazy 2 years. I can't believe that I'm saying that it's been 2 years. Everybody's, obviously in shock that it's been this long. This has been going on forever at this point. And every time it seems like things are getting better and potentially going back to normal, well, things hit the fan. And whether it's, we can have that discussion or argument about the politicization, I don't know how to pronounce that, of science and of the virus and what's true, what's not true. But one thing for certain is that this virus is here, it's real, and at this point everybody seems to be getting it. We have the new variant Omicron that's been going around the block now, and just like Oprah giving away new iPhones, Omicron for you and you and you and you, right? It is very common and it is getting around all over the place. We expect that we're probably around the peak right now, give or take, and we should be having a decrease in spread over the course of the next couple of weeks, hopefully. If other countries are any indication of that, we will see that as well. That being said, there have been a lot of people infected with this, and it seems like more people infected with Omicron at this juncture than Delta or the OG variants, or any of the other lesser known variants that we've actually been encountering. The good news is, quite frankly, just like the other variants, although it is a very contagious condition, it seems like the mortality rates associated with Omicron are a lot less. Part of that is because of the nature of the beast. Part of that is because of the amount of vaccinations that we have and boosters and all that kind of stuff. But even for those that aren't vaccinated, there are still people that are surviving. The downside, and I'll tell you this because of my perspective in conversing with other healthcare professionals and those that are in the hospital systems, Omicron did and is causing an increase in the use of hospital resources, and there have been a lot of beds that have been taken up, and a lot of folks that are getting sick. By and large, those that are hospitalized and are having more severe disease are those that are immunocompromised, older, the unvaccinated, and those that have other comorbidities that are causing issues. But even if you are not hospitalized, and even if you have a milder course of COVID, we're seeing more and more evidence of the true realization that long COVID or residual symptoms in one way, shape, or form is actually a reality. And the more commonly discussed residual symptoms of COVID infection include things like fatigue, include things like the decrease in smell or taste that can linger on for weeks to months. But one of the lesser known or lesser discussed potentially long-term sequela or issues associated with COVID infection include pain. And there's some interesting research that came out in 2020 and 2021 that has discussed the prevalence of pain after COVID And part of the reason behind this, part of the theory behind this, is that COVID itself has a pro-inflammatory component to it, and that inflammation in your body does increase with COVID, and that can affect things that are already predisposed to inflammation. So, for example, there have been a lot of cases of people that didn't even realize they had COVID, but they had some increase in back pain or something along those lines, and then found out that they were positive. And it's because they had some pre-existing back issues, and when COVID infected their body, they were lucky and didn't have any issues with their lungs or cardiovascular system or whatnot, but they ended up having an increase in inflammation in their body that, for all intents and purposes, aggravated something that was pre-existing, such as their low back. But we're seeing some interesting things, and I'm just going to highlight actually some articles that have talked about pain associated with COVID. So one of these articles is this one that came out in 2021 that actually talked about the time course and prevalence of various pain conditions that are associated with those that had survived from more severe respiratory infection with COVID. Now, this was interesting because these are patients that had more significant disease, right? So there was more prevalence of the virus and more significant inflammation systemically that was caused from it. And it looked at a sample of 25,000 patients that had COVID-19, whether they were hospitalized or not, and looked at the different types of pain conditions that had occurred afterwards in them. And this was actually basically a review of various different information that was recorded, and found that there was myalgia or muscle pain, joint pain, and chest pain that really ranged in percentages according to the different reports, but overall, basically looking at various different reports, demonstrated that about 10% of individuals that had more severe COVID infection would suffer from some level of musculoskeletal pain afterwards within the first year of infection. So pretty fascinating. Now, obviously, this was more of a the severe infection population, but nonetheless, 1 out of 10 people would have some level of musculoskeletal pain, whether it's involving their muscles, their joints, or things like their chest, which in the severe population could be attributed to the fact that people had more respiratory illness, coughing, difficulty breathing, various things that could more directly affect their chest musculature. But nonetheless, a really interesting paper that showed that, the musculoskeletal pain conditions after COVID definitely can be there. And there was another paper in the British Journal of Anesthesia that looked at what are the different risk factors that are associated with COVID. And I'm going to zoom into this guy a little bit more so we can see this a little clearer. And what was interesting, this article specifically looked at the pain after COVID and how that influences how we're going to rehab, how we're going to recover from these this illness. And the things that were risks for chronic pain. So this is pain that is lingering, lasting after the infection, included a lot of different factors. Were the patients specifically in the ICU, right? Or did they have more significant illness? Was there a neurological component of their infection, right? So COVID does have a higher incidence of infection or irritation or involvement of the neurological system, and I'll get back into that in a second. But was there a neurological component of their infection? And that can certainly play a factor into our system and our system's perception of pain. So really important factor there. Was there a mental health component of this? Was there post-traumatic stress disorder? Was there depression? Was there social factors that are involved with the infection and that process? Were there other musculoskeletal conditions that were more acute that developed after COVID? Were there traumas that were associated with the COVID infection? Did they have to be intubated? Did they have to have any kind of resuscitation or any procedures that were done in any way, shape, or form? And finally, what kind of factors were playing into their actual rehabilitation? Were they able to actually go to a rehab facility or not? Were they able to actually get the resources necessary to recover from the infection? These were actually really interesting factors that played into whether these patients had chronic pain or not. But I do want to key in specifically on the neurological component, because I do think that that's an important thing that we oftentimes neglect when we talk about chronic pain. And now we actually had some reports that talk specifically on that, and this was an article from 2021 that looked at the fact that the COVID infection could actually cause inflammation in the central nervous system. So early on we saw an increased risk of things like stroke when you had COVID infection, and we realized that there's an increased inflammation to the central nervous system, and even things like Parkinson's and other central nervous system diseases could actually have an increase of symptoms associated with it when there was a COVID infection. So we see that there's a direct influence to the nervous system with COVID infection. That ends up being really important when we talk about pain, because pain, really, when we say the word pain, pain is the brain's perception of something going on. And I've done a previous talk on what pain means. There are different types of pain. There's nociceptive pain, which is pain that we feel when we have damage or when we have a trauma that occurs. There's neuropathic pain, which is pain associated with the nerves carrying the signals. And that increase in nerves carrying signals of pain can then cause discomfort. And there's this concept of hypersensitivity, or what happens when the nervous system becomes very sensitive to any stimuli, and then the brain then perceives that stimuli as painful. And that's very different than nociceptive pain. That's very different than pain that occurs when you have a trauma, right? Because if you cut your finger, ow, that hurts. Very different than if your nervous system is now interpreting even just hitting your finger as damage, right? Banging my elbow against a table might cause pain, but it's certainly not causing damage unless I bang it really hard, right? But if I slightly bang it, but if the nervous system is now hypersensitive to pain, even banging my elbow slightly may cause a significant increase in pain. And that nerve hypersensitivity can be upregulated when we have inflammation to our central nervous system, and that certainly could happen with the infection with COVID. So that's definitely something that's thought provocative, right? Because you have to realize at this juncture then having this infection could legitimately upregulate our sensation of pain from various even smaller injuries, and that could really be functionally limiting. But in addition to the central nervous system, we have some evidence that suggests that even the peripheral nervous system can be affected by COVID infection. So that same kind of pro-inflammatory, that pro-neuroinflammatory action that takes place in the central nervous system can take place in our peripheral nervous system as well. Well, what's the difference between the central nervous system and the peripheral nervous system? Central nervous system includes the brain and the spinal cord. The peripheral nervous system are the nerves that exit out of the spinal cord and go down the arms, go into our body, go down our legs. And these are the nerves that can be affected when we have a pinched nerve in our back. It can be affected when we have an injury to a limb. Can be affected when we have pinching of the nerve in other areas of our body. And this part of the nervous system can also have inflammation, can also have an increased sensitivity when we've had COVID infection as well. So the reality is that not only can COVID infection potentially cause an increase in inflammation in things like joints and muscles, which can then cause nociceptive pain, right? When we have damage to joints or muscles, inflammation or joints to muscles, this causes us to feel pain. But also the nerves, the electrical wiring that carry the pain signals, those nerves themselves can have an increase in inflammation. And that's an important factor to consider, because the reality is that with everybody getting Omicron these days, a lot of people are surviving. Not a lot of people are dying, although there are people that are dying and people are getting increased infection. There are a lot of people that are surviving. But with surviving this condition, there, based off of at least some research, at least 10% of people that are going to have some level of musculoskeletal pain. And it's still unknown what the prevalence of neuroinflammation is actually going to be. And that means that, if we have pain after an inflammatory condition like COVID, is that something that we should just, brush off and assume is going to go away? Or is that something that we need to, acknowledge as a red flag, or acknowledge as a check engine light in our system and say, all right, this is an opportunity for us to actually take the time to analyze, is this something that was pre-existing that got aggravated? Is this something new that has come up? Or is this an inflammatory process that just needs to calm down? And how do we strategize around that? Because the reality is that if we do have pain, pain causes us to do things that actually propagates that pain worse. Pain causes us to shy away from certain movements. Pain causes us to walk in funky ways. Pain causes us to be aware of certain actions that may then cause the pain to get worse. But that change in our motion, that change in our activity, that change in our gait, in our ambulation, in our walking, in this, that, and the other thing, actually can cause us to develop abnormal patterns of motion or movement that can then cause pain to be worse. Or worse yet, that can cause other injuries to occur. And that's something that we need to be aware of, be cognizant of, and be prepared for. So if you've had COVID, all right, to say it this way, or when you get COVID, because it's very likely that in one way, shape, or form in our lifetimes we will get this disease. If we do develop some increased pain afterwards, I implore you to actually think about that and get checked out. See your physician and mention this. And if this is something that's causing you to have limitations in your function or changes in your activity, in your motion, in your walking, in your biomechanics, then this is something that I need you to be proactive about. Seeing somebody that specializes in something like physical medicine and rehabilitation, or musculoskeletal medicine, sports medicine, even things like pain management, is something that you should do in order to make sure that we're crossing our T's and dotting our I's. Because if there is something that we can address, if there's something that we can do to get the body moving correctly, that is important to prevent things from getting worse. Because there's one thing to get pain after COVID and have this as a part of your lingering symptoms. It's an entirely different thing for that to become chronic pain. And it's an entirely different thing for that to becoming a negative influence in your function and in your life. So all in all, we have to recognize the fact that, you know, pain can happen after COVID, and it may be 1 out of 10 people that experience it, or shoot, maybe more, maybe less. We don't know at this juncture, but it is something that has been noted, and it's something that we do need to be proactive about. I hope that all made sense. If you have any questions about that, then please feel free to comment. Debbie joined us today, said thank you for this. You're welcome, and thank you for joining us. And if you enjoyed this, then please share, like, and spread the word, because, you know, unfortunately at this juncture, in one way, shape, or form, COVID is a part of our lives and our existence in our culture right now. But the sequela of surviving COVID is not something that we have to sit by idly and just deal with. There are things that we can do to be proactive about yourself. That's the message that I have overall with all of these Facebook Lives, is be an advocate for yourself, be a proactive, and take care of yourself. That's it. So if you have anything else that you want me to talk about, please feel free to contact us, comment, DM, email us at info@fxregencenter.com. You can always visit our website, or our Facebook, or YouTube, or Instagram, all those kind of things. I hope you guys are doing well with the new year so far. Stay safe and stay sane, and I will see you next time.